I'm Dan Deschler. I'm a professor of otolaryngology, head and neck surgery at the Massachusetts Eye and Ear and Harvard Medical School. I practice the care of patients with advanced cancers and tumors of the head and neck area with an emphasis on advancing reconstructive methods of that area to provide people with the utmost successful reconstructive and rehabilitative efforts. As part of that, I've engaged in research in technical devices to improve function, the advancement of new surgical techniques to make these things better, as well as educational and system approaches to increase efficiency and efficacy of head and neck surgery for patients who are going through these very challenging disorders. An amazing aspect of practicing in an academic center is the ability to combine groundbreaking and forward-moving research with the outstanding clinical care that we provide. And I've had a wonderful opportunity to work with various collaborators during the past 30 years to build different research avenues, whether it be testing different reconstructive techniques, incorporating new technology into voice after laryngeal cancer surgery, and then even approaching education and systems to better provide care in an efficient and excellent manner. I grew up in a small town in the Midwest and received my undergraduate degree in history at Creighton University in Omaha, Nebraska. I was then fortunate enough to get into Harvard Medical School, where I met my wife. We then did our residencies at the University of California, San Francisco, and our fellowships in Philadelphia. There, I worked with my mentor, Rick Hayden, who was a pioneer in the treatment of head and neck cancer, as well as the advancement of new reconstructive techniques called microvascular surgery. I worked with him for 5 years, and then was fortunate enough to be recruited to the Mass Eye and Ear in 2000, and have practiced here since then. One of my primary goals as an academic head and neck surgeon has been to be in a position to make a positive difference within the specialty and within people's lives. I've had the opportunity to do that with the introduction of new techniques for voice restoration after laryngeal cancer surgery, as well as the introduction and fine-tuning of various reconstructive methods for the head and neck. Here at the Mass Eye and Ear, I'm most proud of the development of the division of head and neck cancer surgery that we've had over the last 2 decades. I served as the division director for a decade and was part of the group that started our fellowship in advanced cancer surgery. This opportunity then set the stage for holding various roles in national organizations to further that mission. As an academic physician, whenever I give a talk, I'm asked to give any disclosures. And the one I always give is that I truly love what I do. I love the people I work with, and whether it is with a discussion in the office, with a surgical intervention, or sometimes just listening, I am honored and blessed by this opportunity I have to be a positive part of people's lives.